The paramedic in the doorway hadn't moved in 10 seconds. He was staring at the nurse with her hands inside a dying man's chest. And when he finally found his voice, he said one word. And every person in that trauma bay turned around. Kandahar. *. 4 years. Nobody at Mercy Creek Regional had ever asked Ava Crosby a single real question about herself. In the next 9 seconds, all of them would. Welcome back to Nurse Stories. Hit subscribe if this is your first time here. And ask yourself one thing before we start. Who's the quietest person you've ever worked with, and what don't you actually know about them? Nobody looked twice at Ava Crosby. She liked it that way. She worked nights at Mercy Creek Regional, a 24-bed critical access hospital 90 minutes from the nearest trauma center. 4 years there, and she had never once raised her voice, never once been late. Without ever deciding to, she'd clocked both exits of any room she stood in, and the distance back to whatever cart held the equipment. She'd long since stopped noticing that she did it. She was restocking that same crash cart at 11 p.m. when Dr. Daniel Pierce found the excuse he'd been circling all shift. "You're still on this dressing?" He said it loud enough for the 2 techs at the nurse's station to hear. Which was the point. "Mrs. Alden's been waiting 11 minutes for a wound check that should take 90 seconds. She has a stage 2 ulcer with new drainage. I want to send a culture before I close it back up." Ava didn't stop taping the gauze. "Lab's running 1 tech tonight. Save it for the morning shift, redress it and move on. I need people who move." Pierce had transferred to Mercy Creek 18 months earlier, from a hospital 3 times its size. And he still ran his department like a man double-checking a ledger. He walked off toward his next chart without waiting to see whether she agreed. Russ Tanley, restocking gauze 2 shelves over, didn't look up either. But said it quietly, mostly to the shelf. "Man documents every last thing. Like somebody's going to make him read it back someday." Neither of them explained what he meant. Neither of them needed to. That was the thing about Ava that nobody had caught yet, in 4 years, when the room got loud. Her hands got still. Right now, with Pierce's voice climbing. Her hands did not shake. Did not fumble. Did none of the small things other people's hands did in a room like this one. She finished the tape. Smoothed it flat with 2 fingers. And once Pierce had turned the corner, she filled out the culture swab anyway. And dropped it in the lab basket herself. Without a word to anyone. Sometime after midnight, the storm turned the parking lot lights into smears through the rain. Russ set a cup of coffee at Ava's elbow without a word, and went back to restocking IV tubing, the way he had every night shift for a year. She'd never once asked him why. Mrs. Alden, propped up in Bay 6 waiting on a ride home in the morning, caught Ava's sleeve as she passed. "That doctor's not wrong about everything," she said, not unkindly. "But he's wrong about you." Ava didn't answer that either. Just tucked the blanket back over the woman's feet and moved on. The lights flickered once. Hard. Dropped to the dim emergency strips for 4 seconds, then came back. Every nurse on shift froze. Ava didn't. She was already moving the cardiac monitor and the second suction unit toward the 2 bays wired to the generator's priority circuit. Sleeves still down. Saying nothing about why she bothered. The call came in at 1:52. By then the rain outside had turned to sleet, glazing the parking lot in a thin, treacherous shine. Wind rattling the bay doors in their frames hard enough that Colleen had checked the latches twice in the last hour without saying why. Route 9 at the county line, narrow, unlit, banked wrong on the curves, was exactly the kind of road that didn't forgive a semi-truck hitting black ice at the wrong second. Dispatch. Multi-vehicle collision. 4 vehicles. Road closed both directions. 1 county unit and 2 mutual aid rigs. The closest still 40 minutes out. Life flight was grounded. No helicopter flies in this weather, not tonight, for anyone. Mercy Creek Regional was the only hospital within 90 minutes a ground unit could still reach. "How many?" Pierce asked, already moving toward the bay. "They're saying 6. First unit's 4 minutes out." Colleen jogged past with an armful of blankets. And if imaging and the trauma bay both pull power at the same second tonight, the trauma bay loses first. Somebody keep an eye on that. She didn't wait for an answer. There wasn't time to give her one. Pierce's hands, Ava noticed, had gone a half second behind him. Reaching for a chart, missing it, reaching again. Her own hands went quiet. Precise. The way hands do when they've already done a worse version of this job somewhere else. She ran the math anyway, not hoping, just counting. 6 coming in. 1 attending who'd never run anything bigger than a bad flu season. 4 nurses. 2 techs. A generator that had already shown its limits once tonight. Not the worst ratio she'd ever worked. Not a good one either. Bay 1 and 2 for the walking wounded when they come in, she told Colleen, already moving gurneys into position. Keep 3 and 4 empty. Whoever's worst goes in one of those, and nobody's hunting for space to do it in. She said it the way a person gives directions they've given 100 times before. In a building nobody in this room had ever seen her stand in. The first ambulance brought in an elderly man. Blood matting one side of his gray hair. Eyes not tracking right. Walt Novak, 71, driver of the lead pickup, closed head injury, fractured ribs, pressure dropping. His hand shot out and closed around Ava's wrist. Eyes unfocused, finding her face. Doc, he said, pleading, somewhere else entirely. Don't let me go under. Not yet, Doc. For half a second, a different name rose in Ava's throat instead of a reassurance. A name she hadn't said out loud in 12 years. And she swallowed it before it reached her mouth. You're not going under, she told him, low and even. And something in the way she said it made Russ, 3 feet away with a blood pressure cuff in his hand, go very still. You've done this before, Russ said quietly, not quite a question. Not here, Ava said, and moved to the next bed. Minutes later, 2 more units brought in Marianne Cole and her 16-year-old daughter, Piper. Piper's forearm bent at an angle it shouldn't bend. Marianne clutching her neck and insisting she was fine in the voice of someone who is not. And a young man, Adam Yates, 23. With a scalp laceration already soaking through its field dressing. Piper had gone quiet in the particular way teenagers go quiet when they're trying very hard to be brave in front of a parent who is failing to look brave herself. She held her splinted arm against her chest and watched the department the way a person watches weather, trying to guess, from everyone else's faces, how bad this actually was. Pierce ran triage the way the manual said to. First arrived, first assessed, in order. He put Marianne in a holding chair because she was talking and walking, and moved to the next chart. Because the manual had no column for the flatness in a mother's voice when she's holding her own neck carefully and trying not to let her daughter see her do it. Ava caught it walking past with a blanket for Piper. Collar her and get her flat before anyone clears her to sit up, she said, once, quietly, to Colleen. Cervical spine, not soft tissue. Colleen didn't argue. Something in her own voice, giving that order out loud, sounded strange to Ava's own ears. A register she hadn't used on anyone in 12 years. And she noticed it, and said nothing about that either. Adam watched from his own gurney, scalp laceration half-dressed, frowning at Colleen taking an order from a floor nurse without so much as a raised eyebrow. Why's she running this and not him? He asked, nodding at Pierce. Colleen didn't have an answer that made sense yet, so she didn't give him one. She'd worked beside Ava for 4 years and had never once seen her raise her voice, never once seen her hesitate either. And until tonight, those 2 facts had simply lived next to each other without anyone asking what they added up to. It cost 4 minutes nobody in the room believed they had to spare. It would cost something else, later, when nobody was expecting the bill. Ava sat Adam down, checked his laceration with 2 gloved fingers, kept her voice at one level the whole time. Scalp wounds bleed like this because of how close the vessels sit to the skin, not because of how bad they are. 4 or 5 stitches, and a story for work on Monday. He laughed, too fast, and let his shoulders drop for the first time since the ambulance. Piper's forearm got a temporary splint before anyone had time to give her anything for the pain. She held still for it better than most adults did, watching Ava's hands the whole time the way a person watches something they're trying to memorize. Colleen came by with a count a few minutes later. That's 5 accounted for, 4 here. 1 refused transport at the scene. Extrication still working the cab on the 6th. County says another 10, 15 minutes. Pierce noticed the chest seal kit already out on the counter nearest the bay doors. We're not going to need that tonight, he said, and moved on. 6 minutes later, they would. Walt Novak had started fighting the head injury protocol the way concussed patients do, pulling at the pulse ox on his finger, insisting he needed to check on his truck. Ava crouched level with his eyes instead of standing over him. Walt, what's your dog's name? Diesel. He blinked at her, thrown by the question, which was the point. Diesel's fine, your truck's fine. And you're going to lie still while I make sure your head is fine too. He settled. The way people do when someone finally talks to the part of them still listening, instead of the part that's panicking. Colleen, watching from across the room, filed that away too. The same way Russ had filed away the stillness by bay 3 hours earlier. Not understanding it yet. Just noting that it worked. Ava didn't need the count repeated. She was already restaging the crash cart she'd restocked 3 hours earlier, at the start of an entirely different shift. In what felt like an entirely different version of this same building. Same hallway, same lights. A different set of hands running it now. The radio at the charge desk crackled, a medic's voice, tinny with distance, calling in vitals on the 6th patient, still trapped in the cab. Ava's head came up at the sound and stayed up a beat longer than the traffic warranted. The way a person's head comes up at a voice from a language they haven't spoken in years, but never quite forgot. Dispatch radioed ahead again. Extrication was slow, the cab crushed against the guardrail, and the crew on scene said the driver was talking but not breathing right. Ava had the trauma bay stripped and ready before the ambulance doors opened. Chest seal kit laid out. 14-gauge catheters set where her hand would find them without looking. The fluid warmer already running. Denny Wren, 44, came through at 2:19. Extrication finally successful after 11 long minutes the crew on scene hadn't had to spare. Pale to the point of gray. Rapid, shallow breathing pulling at his neck with every effort. A deep laceration along his thighs soaked through 2 field dressings, blood seeping through a third. And a rising wrongness in the way his chest moved that Ava clocked from across the room before she'd even reached the gurney. The paramedic riding in with him, Jake Ortiz, jacket soaked through, rain still dripping off the brim of his cap, locked eyes with her for half a second at the handoff. Opened his mouth and stopped himself. Not the time. Whatever he'd almost said could wait exactly as long as Denny Wren could. Ava's hand went to the strap on Denny's thigh like it lived there. 2 inches above the wound. Double loop. Twist. Denny cried out once, and the stain spreading through the sheet beneath his leg stopped spreading. Tell me your name, Ava said, already scanning the rest of him. Pupils, chest rise, color. The way she'd once scanned a body for the wound that mattered most among the ones that only looked like it. Denny. His voice was thready. Denny Wren. Denny, you're at a hospital. I've got the bleeding. I need you to keep talking to me. Been better, he managed, and that alone told her his airway was still doing its job. Then keep it up. Tell me about the truck if you've got nothing else to say. 9 years. Never so much as scratched the paint. He tried for a laugh and didn't quite make it, but he kept his eyes open, and that was the part that mattered. Tourniquets up, 2:19, she called, and Colleen wrote it on tape and stuck it to his collar where anyone could see it. 2 large bore IVs, warm fluids wide open, Ava said next, already threading the first line into the crook of his arm without missing the rhythm of her own sentence. He's lost a unit at least. Probably closer to 2 by the color of that dressing before the tourniquet went on. Reassess that tourniquet in 15. Call the timeout loud every 15 after, she added. I don't want anybody finding out in an hour that nobody's been watching it. Colleen nodded and set a timer on her phone right there, propped against the crash cart where she'd see it without having to think to look. Denny's breathing had changed in the last 90 seconds, shorter, higher in his chest, each one costing him more than the last. Ava had seen that particular escalation before, in places where the next sound after it was usually worse than the one before it. Tracheas shifting, breath sounds gone on the left, tension pneumo, and it's getting worse in front of us. The pulse ox on his finger lost the signal entirely, a body in shock shutting down its own extremities to save what mattered, leaving nothing for the sensor to read. Ava pressed 2 fingers to his neck instead, feeling the rate, watching the color go dusky in his lips. Forget the monitor. He's tachycardic, thready, going gray. Pierce came to look, and his hands did the thing they'd been threatening all night. They shook. Second intercostal, midclavicular, that's what I trained on, he said, voice thin. Chest wall's too thin there on him. You'll go straight through into something you don't want. Fifth intercostal, anterior axillary. More room, less to hit. Ava was already gloved, counting ribs with the flat certainty of someone who'd done this on far less stable ground than a hospital floor. You've got the airway. Talk to me if his pressure drops. Around them, the rest of the department kept moving without needing to be told. Colleen timing the tourniquet, a tech running a fresh bag of fluids, Russ clearing a path through the curtain for the equipment cart. Because somewhere in the last 20 minutes, without anyone announcing it, the whole room had started organizing itself around the sound of Ava's voice. Left side, fifth intercostal, perpendicular, hiss, nothing. Then his chest moved. The lights in the bay dropped to the dim red emergency strip, imaging, pulling power for Marianne's cervical films, at the worst possible second. A tech somewhere down the hall swore. A monitor alarmed 2 rooms over cut out along with its screen. Denny's face was barely more than an outline now, the seal under Ava's fingers reduced to texture instead of sight. The same fingers that had just counted his ribs, reading the edge of the dressing instead of a number on a monitor. She didn't stop. She finished by feel. The lights came back 8 seconds later to find her already reaching for the next thing she needed. As if the dark had never happened to her at all. Nobody said anything for 3 full seconds. Then Jake Ortiz, still by the door, said it. Kandahar. Asterisk. He said it again, sharper, sure of it now. Ava Crosby. Staff Sergeant. 68 Whiskey. He looked around the bay, at Pierce, at Russ, at Colleen frozen with a bag of fluids in her hand. You people know who this is? She ran a casualty collection point under direct fire for 40 minutes so the rest of us could get people onto the birds. 2 tours. There's a combat medical badge sitting in a drawer somewhere most of you have never heard of. Because it's not the kind of thing you put on a resume. Russ set the manifold down, very slowly, and said nothing at all. Colleen stood frozen by the supply cart a moment longer than the task in front of her required. Doing the same quiet math everyone else in the bay was doing. 4 years of shifts beside this woman, 4 years of small talk that never went past the weather. And not 1 hour of it had hinted at any of this. Ava didn't look up from the seal. She pushed her sleeves to the elbow, and there it was. A thin band of old, deliberate ink at her wrist. 1 small chevron worked into it. The kind of mark medics in her unit gave each other with a sterilized needle somewhere between deployments. He needs a chest tube and a surgeon, not a story, she said. Get Dr. Pierce the trauma line for the regional center. Piper Cole, arm splinted, watched all of it from her gurney. Are you really what he said? I'm a nurse, Ava said. Tonight I was also that. It wasn't really an answer. It was the only one Piper was going to get. And it satisfied her more than a real one would have. Walt Nowak's hand found her wrist again as she passed his bed, calmer now, eyes clearer. Knew a doc when I saw one, he muttered. My boy did 2 tours. You all get the same look. Pierce picked up the phone. His hands had stopped shaking. Anterior axillary line, blunt dissection, finger sweep before the tube, The surgeon's voice said through the speaker, tinny with distance. You'll feel the lung expand under your finger before you ever see it on a film. Take your time, 30 seconds slower and careful beats 30 seconds faster and wrong. Pierce's hand found the 5th intercostal space on the first try and didn't need her to confirm it. He glanced at her anyway. She gave him one small nod, and his shoulders came down half an inch. Ava kept Denny's vitals coming in a steady, unhurried stream the whole time, pressure, rate, color, the same cadence she must have once called over gunfire. In the middle of it, Piper started crying out from the next bay, pain finally breaking through the adrenaline. Pierce was 3 steps toward her before he caught himself, remembering the tube in his hand. Stay with Denny, Ava said, already turning. I've got her. She had the dose Pierce had ordered an hour earlier drawn and pushed before Piper's crying had crested. Her voice dropped to the register she'd used on Walt. I know. You're almost through the worst of it. Marianne, still collared, reached her hand out blind until it found her daughter's. Nobody in the department needed telling twice, after that, which of the 2 people running the room actually knew what they were doing. Once the tube was in and draining, Pierce checked the tourniquet strip on Denny's collar without being told to, did the math, and loosened it to a pressure dressing the moment the bleeding held without it. He found Ava at the supply cart afterward, and stood there a moment before he managed to say anything at all. 5th intercostal. I've never done it that way. Nobody ever corrected me. You have now, she said, restocking. Tonight just wasn't a good night to learn it the hard way. It wasn't quite an apology, and it wasn't quite forgiveness. Pierce nodded once and went back to his patient. That was enough for both of them. At least until morning made him say the rest of it out loud to someone whose job it was to listen. Jake stayed by the door a while longer, watching her chart. I still think about Ashby, he said finally, quiet enough that it stayed between them. Every deployment anniversary. Figure you do too. Ava didn't answer that one out loud. Something in her face did it for her. You did everything right that day, he said. I was there. Somebody who actually was ought to get to say it once. Thank you, she said, and meant it. For what it's worth, Jake added, there's a few of us who'd be glad to hear you landed somewhere good. He didn't wait for her to answer that one. Some things don't need an answer, just saying. He left a minute later, back out into the sleet. 3 more calls behind this one. Denny went out by ground transport at 4:15. 1 lane of Route 9 finally scraped clear, his tube draining clean. He caught Ava's sleeve with 2 fingers on his way past. Somebody's going to call my dispatcher about the load? Already done. Refrigerated cargo isn't your job tonight. Breathing is. And you're doing it fine. He almost laughed, winced instead. And let them wheel him out into a morning that had finally stopped throwing sleet at the ambulance bay doors. Walt held Ava's hand a beat too long at his last check before day shift. His head CT had come back clean at 6, the ribs wrapped, the confusion gone as fast as it had come. I'm calling my boy tonight, he said, and pressed a scrap of paper into her palm. His son's number, written in a shaking hand. Man's a lot like you, from what I hear. Doesn't talk about what he saw over there either. Might do him good, hearing it from someone who gets it without him explaining first. His eyes were wet, and he didn't try to hide it. Ava folded the paper once and put it in her pocket without answering. Marianne's films came back clean, sprain, not fracture, exactly what it had looked like from the start. She didn't apologize for the caller or the 4 minutes it had cost. Nobody expected her to. She and Piper went home a few hours later with a story they'd tell for years. And a version of the night that started with asterisk. There was this nurse. Asterisk. The gram stain on Mrs. Alden's wound came back at 8. Gram-negative rods, heavy growth. Nobody said anything to Pierce about it directly. Mrs. Alden herself, wheeled out to her ride a little after 9, caught Ava's sleeve one more time on the way past. Told you he was wrong about you, she said, and didn't wait for an answer, because she hadn't expected one the first time either. The morning debrief happened at 7. The network medical director on a video call from home, coffee visible on the desk behind her. Your nurse resequenced your triage sheet on her own authority, she said. I need to understand why the best judgment in that room came from someone you spent the night trying to slow down. The protocol exists for a reason, Pierce said, and even he seemed to hear how thin it sounded the second time he'd said it that morning. It does. It also isn't the same thing as judgment. And last night the room needed judgment more than it needed the sheet followed in order. The director didn't raise her voice either. She didn't need to. Pierce didn't have an answer. He thought about saying that he hadn't known who she was, that nobody had told him. And stopped himself before the sentence made it out loud, because he understood, sitting there, that not knowing had never been his excuse. He simply hadn't asked. Colleen, sitting in, added one line for the record. I'm charting the decompression as physician directed. Because that's what it was. Ava, restocking 2 rooms away, heard it through the open door and let it stand. She had never once needed the record to have her name in it. She only needed it to be quiet enough, afterward, to let her go back to being nobody in particular. By 8, Pierce was alone in the residence's room writing his incident report by hand, 3 drafts deep. The malpractice suit from his old hospital sitting somewhere behind all of it, the way old weather sits behind a bad knee. He would keep his job. The regional director post he'd been angling for all year was no longer his to lose, because it was no longer his to have. Russ found Ava at the cart. You want to tell me the rest of it? Not much of it worth telling. She kept laying out syringes, one at a time. 2 tours, Afghanistan. Somebody back there. Not a question. She didn't answer right away. Laid out a second syringe, exactly parallel to the first. Dean Ashby, 21. He didn't make it, Russ said quietly, filling the silence instead of asking her to. Did everything by the book. He didn't make it anyway. A third syringe, lined up exactly parallel to the other 2. Some nights that's still the whole story I've got. Russ waited, in case there was more. There wasn't, not tonight, and he didn't push for it. 22 years, he said, and Jake Ortiz walks in for 4 minutes and tells me more than I learned in all of them. He talks too much. He isn't wrong, though. Russ let that sit a second. I'd have liked to know sooner. Not for me. For you. Carrying that alone in a building full of people who'd have carried some of it, if you'd let them. Old habit. Maybe it's time for a new one. She almost smiled. The first Russ had gotten out of her in 4 years. He put a hand on her shoulder, once, and went back to his cart. Teach the trauma refresher next quarter, Colleen said, passing by. Whether you like it or not. I don't like it, Ava said. I'll teach it anyway. The physician assistant who'd been covering minor cases all night finally got free to finish Adam Yates's sutures. Adam watched the whole department reorganize itself around one woman all night without a raised voice. Is she going to be okay? He asked. The bit I saw, with the truck driver. She's the one making sure everyone else is, the PA said, tying off the last stitch. I don't think anyone's checked on her all night. Neither of them had an answer for that. The PA finished the last stitch, and Adam sat there a moment longer than he needed to. The way people do after they've watched something they don't yet have a place to put. The day shift filled the halls a few minutes later. Loud and ordinary, as if the night had happened to a different building. Ava went back to the crash cart. She'd done everything right twice now, 12 years apart. Once, it hadn't been enough. She reached into her pocket, found the folded paper Walt had pressed into her hand, and stood there a moment with it between 2 fingers. A stranger's son. A phone number. A maybe she hadn't said yes or no to yet. She didn't unfold it. She didn't throw it away either. She put it back, and restocked the cart anyway. The way she would every night after this one, sleeves down, eyes on the door. Still bracing. Who in your life has stayed quiet for so long that you stopped wondering why? We measure people by their volume, and the quiet ones get walked past, underestimated, occasionally humiliated in a room nobody bothers to read carefully. They've usually gotten that way for a reason, and the reason is rarely a good one. It happens in hospitals. It happens at your own kitchen table. The people who survived the most are often the easiest to overlook. Because somewhere along the way, they learned that not asking for anything was safer than asking and being told no. This isn't a story about finding a hidden hero. It's smaller than that. It's a reminder that the next time someone's stillness reads to you as weakness, you might just be looking at someone who's already survived something you haven't. If this one got to you, that's Nurse Stories. Hit like, subscribe if you're new here, and tell us in the comments, who's the quietest, most underestimated person you've ever worked with?